preface, similar goal with the first case. So my PI, Dr. Spencer, is a very sees a lot of uveitis case in San Diego County, and he reports many novel associations for uveitis. So overall goal of this case, similar to last case, is to report a different potential manifestation of uveitis. In this case, I believe it's due to MKD. So the title of the presentation is Retinal Vasculitis and Cotton Wool Spots due to Mevalonate Kinase Deficiency, aka MKD. So MKD is a rare genetic inborn metabolic condition caused by mutation of the mevalonate kinase gene. So currently, there are very few reports on the ocular manifestation of MKD, and typically when you read through the literature, it mostly reports cataract as well as retinal degeneration of MKD, but also that's been largely limited pediatric case. So in this case, we report something that's different from typical. We report the case of MKD contributing to cotton wool spots, uveitis, and vasculitis. So we emphasize the need for clinicians to become aware of this as a potential ocular manifestation of MKD. So the case description, patient was a 24-year-old female with history of recurrent febrile episodes, polyarthritis, gastrointestinal disease, presenting with several months of autopsia and medioplasia with a remote history of cotton wool spots. Initially, her exam was unremarkable and without any ocular inflammation. Fluorescein and endocrine green angiography, however, reviewed mild bilateral late phase capillary leakage in the far periphery of her eye with the predominant retinal vasculitis. Given her systemic condition and lack of response to medications, we ran a genetic testing, which reviewed a heterogeneous mutation of mevalonate kinase. She was diagnosed with MKD, which is a deficiency of mevalonate kinase, and she was started on anti-IL-1 immune therapy. And here's two images showing fluorescein angiography showing mild bilateral late phase capillary leakage in the far periphery of both eyes with predominant retinal vasculitis. So currently, there are very few articles, first of all, on the ocular manifestation of MKD, which is already itself a rare genetic disorder affecting cholesterol and non-cholesterol synthesis. Typically, MKD patients exhibit many non-specific clinical presentations, so anything that we can do to help clinicians become more aware of the potential ocular manifestation of MKD is important. In this case, this is the first reported case of MKD presenting with cotton wool spots, retinal vasculitis, and we highlight the wide clinical spectrum of MKD and importance for clinicians and even non-ophthalmologists to be aware of that if you saw patients presenting with vasculitis, you should be suspicious of MKD as a potential cause. And that's the end of my presentation.
Great, thank you again. So we're initial thought about this patient. I mean, they kind of come off as like a rheumatological presentation.
Yeah,
Was that
exactly.
something that was considered?
Yeah, thank you, 100%. So initially, I was just say that she had polyarthritis, so we thought this could be a systemic, like you said, a rheumatological disease that's causing the vasculitis in the eye, which is entirely possible. But she's been treated with for systemic diseases for years. But however, this onset later, so we become more suspicious for other potential causes.